The treatment and education of autistic and related communication handicapped pupils, also known as TEACCH, offers ways of structuring the curriculum and the classroom in order to reduce stress and promote learning. The TEACCH program suggests that there needs to be structure to reduce stress, encourage learning and address the welfare of the child. This is mostly provided for those with autism through visual and structured learning, as recommended in the TEACCH program. Strategies used are designed to address the difficulties faced by all with autism and be adaptable to whatever style and degree of support is required in the classroom. Although no single education or treatment approach has been shown to be uniquely successful with all pupils with autism, there are some which have proved particularly helpful in educational support for pupils. The TEACCH program has gained popularity and is widely used in the UK and USA. The TEACCH program is a university-based project founded by Eric Schopler in 1980 at the University of North Carolina at Chapel Hill. Project TEACCH incorporates behavioural principles in treating pupils with autism, but differs from other interventions. TEACCH program focuses on maximising the autistic pupil's skills while drawing on their relative strengths rather than attempting recovery from the disorder. The program is designed around providing structured settings in which pupils with autism can develop their skills. Teachers establish individual workstations where each child can practice various tasks. For example, visual motor activities may include sorting objects by colour or size. TEACCH emphasises a collaborative effort between treatment of staff and parents. Parents are thus encouraged to establish routines and cues in the home similar to those provided in the classroom environment. Teachers who adapt this should try to see the world through the eyes of the autistic child, and to use this perspective to teach them in our culture as independently as possible. Teachers should adapt inclusive and coordinated programs dedicated to implementing relevant support services for children with autism. TEACCH outlines that the person is the priority, and the program puts emphasis upon the importance of individuality. TEACCH claims to provide each individual with their maximum level of autonomy and independence, and to have evolved from a number of viewpoints, including psychological, educational and social. The TEACCH philosophy maintains that education forms the backbone of the program and puts lifelong educational skills first, which can be therefore adopted into life. It is applicable to high functioning and more severe forms of autism. Instead, it makes use of several methods and various combinations according to each individual's needs and emerging capabilities. These children gain more confidence within class, which in turn develops communication and understanding at the level through their use of visual timetables, preparations for change, and structured activities, which should be adopted by the teacher. The main aim of TEACCH remains for its pupils to achieve maximum independence and reach the three goals, which are to understand the world around them, to acquire communications in order to communicate with others, to gain the necessary competence to make choices about their own lives. The driving force of the program is the improving of communication skills using education as a means to achieving these goals. Only a small number of treatment outcome studies to date have investigated the effectiveness of TEACCH. Schopler et al. 1982, for example, gathered data from 348 families whose pupils were currently or had previously been registered with the program. Those who were involved range from 2 to 26 years old, and cognitively from severe mental retardation to normal intellectual functioning. Furthermore, the study went on to emphasize that the number of participants that were subsequently institutionalized was reduced to 7% compared with rates of 39% to 75% that had previously been reported. However, it lacks standardization and independent assessment measures. Ozanov and Kakort, 1998, tested the effectiveness of TEACCH specifically in the home-based instruction for pupils with autism. Parents were asked to focus on areas of cognitive and academic skills related to school success. This group was composed of 11 preschool pupils with autism who received 4 months of home-based studies. The group were appraised before and following the 4-month program using the psychoeducational profile, which provides Detailed assessment of the pupils. The results showed that the pupils receiving TEACCH tutoring developed in the areas of replication, fine motor, reaction to change, and non-verbal abstract skills, which was an improvement of 3 to 4 times greater than the control group. Moreover, the treatment group showed an increased developmental gain after the 4-month intervention. Although this study provides some support for the TEACCH program, the results are affected by some limitations, including the lack of randomized control conditions, the small sample size, and the original study was not designed to supplement to the child's normal day. These results were similarly recorded by Science 1996 in a study in Northern Ireland. However, in their critique of 2001, the Emergency Care Research Institute outlined that there was a high dropout rate of 25%, which questions the validity of the results. 3 additional studies have been conducted to document outcome data of pupils who received the TEACCH services, and these studies indicate substantial increases in IQ scores. Pupils accessing TEACCH services beginning at the age of 3 who were non-verbal and had high IQ scores range from 30 to 50, demonstrating a 22 to 24 point increase in IQ scores. In each of these studies, gains were most significant in very young pupils who were non-verbal prior to the intervention. There is still a need for it to be tested on a larger independent scale that is controlled to assess pupils' performance in the TEACCH program. It could then be adopted into Ireland.